Yale Healthcare Conference was one of the reasons why I came to Yale. My name is Yelena Yakunina, and I am a first year at Yale School of Management. Because I see myself in the future in healthcare, I think it was one of very important factors for me that I will have this opportunity to participate in the healthcare conference.
I got involved in the conference last year. I was a member of the Yale Healthcare Life Science Club looking to get more involved in the healthcare ecosystem. My name's David Rodriguez. I'm a second year, class of 2012 at the Yale School of Management. This year I am helping the committee interface and liaise between the School of Management and the other healthcare interested organizations on campus.
My summer internship was in healthcare. That was my first exposure to the healthcare industry. I wanted to continue pursuing healthcare, potentially as a career post-MBA. My name is Erin Solano, and I'm a second-year student at the Yale School of Management, and I'm on the executive committee for the Yale Healthcare Conference, co-chairing the marketing committee.
I came here knowing that I was interested in healthcare. Didn't know exactly what. I had worked in the IT realm of healthcare, working with electronic health records, and so I thought that getting involved in the conference would be a great way to explore other options within the healthcare realm. My name is Joff Hatton. I'm a second year at the Yale School of Management. I was asked to be the co-chair of this year's conference.
Joff and I worked on the conference together last year. I was actually the head of the finance committee and he was head of content. My name is Dan Gong. I am a second year medical student at the Yale School of Medicine. So the theme for this year's program was set by both Joff and me.
Some conferences focus on technology and innovation in technology, and we are much broader based than that. So while we have some sessions on innovation and technology, we apply it to a much broader spectrum. We discuss innovation in the provider space, in finance, in nursing, in public health. I really feel like our content committee this year pulled down some really amazing people to talk.
Yes, see it. Sit in the classroom for 2 years, take the points, and then we go and live in the hospital. So we're right in between.
I think the conference is example number one of what the Yale School of Management strives to accomplish. Even in the planning of this conference, we have attracted students from all across Yale's disciplines. Not only that, we've created a high-quality conference where the biggest names and brightest minds in healthcare have come here today to talk with each other. Venture capital, payers, providers, physicians, really exemplifying what Yale's trying to do. People from all backgrounds coming together with a common thread of wanting to tackle problems in this industry, and I think it's a perfect example of that.
Definitely learned a lot about working on teams and how teams can collaborate and some of the things that work well and some of the things that don't work well. So this conference has provided a lot of lessons that I can take to the workplace that gives me an advantage as a leader coming into a management position.
This is something that Dan and I could never have done on our own.
We would have conference calls periodically. Thank you so much for coming. Oh, sure. We really are thrilled to have you.
My experience working with the MBA students has spanned over the last 5 years, being a member of the advisory group, which is actually a lot of fun.
It is truly amazing to watch the students who actually think they know what they're getting into at the beginning, and then watch them kind of grow and engage in what it takes to put on a conference for this year. 500 people with 16 breakout groups, and I don't know how many outside speakers. And it is a major undertaking, and it is just, it's amazing, and it's really a thrill, if you like to teach, to watch them rise to the occasion.
Being able to interact with them, hear their insights and their thoughts on how to manage the conference and issues that come up has just been amazing.
It's really an easy job because the students are highly effective in organizing and planning. One of the fun parts of the job is brainstorming the leaders that we should bring in, and then who has connections with those individuals, right? I was proud to be able to invite and bring in the president and CEO of America's Health Insurance Plans, Karen McNaney. She gave an incredible keynote speech this morning. She connected very well with the DNA of how Yale University approaches its academic and education process. I was very pleased to hear from her.
This conference is just a great example of what Yale can do. So I hold my professorship, my adjunct professorship in the School of Medicine, but I teach in the School of Management and I teach in the School of Public Health. And so the idea of bringing those disciplines together is so key because healthcare doesn't work in one silo or another. Healthcare is everybody working in teams and collaborating all the time.
This is a great time to be in healthcare. But this is not kids' play right now. This is high stakes.
You're balancing the fact that a lot of times what you're talking about are people's lives and sickness and dealing with really some tough times in people's lives. And simultaneously, you also need to take a business perspective. Not only are we trying to help people, but if we can't finance this and make it financially soluble, it's not going to work and we're not going to be able to help people. So being able to take both perspectives, the business perspective as well as the community orientation of helping people, really is critical in healthcare, and I think it just ties in amazingly well.
Welcome everybody. There's an app for that.
But the breakout sessions are always a favorite part of mine because they're a much more intimate setting. You have an opportunity to interact not only with the presenters, but also with the other individuals in the room.
I do think that this conference has been a really great experience for me and really a valuable hands-on experience. It's very different from my normal education in the classroom or even in the hospital because it allows me to step back and to kind of have a high-level view of what the various problems are in healthcare, but also what people are doing in healthcare.
My impressions as I walked onto the mezzanine floor, now I've done this for a number of years, this year the size and scope was far bigger than I think any of us imagined. Clearly, it has made inroads in our industry.
As future leaders, I think it's important to start getting exposed to how the policy feedback loop will work and how policy is formed. Who knows, some of the conversations that will happen in the halls today might form the next great innovation in healthcare, might help refine healthcare policy in the nation and start to address those problems, and I feel really lucky to have been a part of that.